Hey everyone, welcome Top 100 Question Series. Let's start. Question number 1. Which artery is most commonly blocked in myocardial infarction? Here, correct option is option B, left anterior descending artery. Question number 2 is, what is the first line drug for eclampsia seizure prevention? Here, correct option is option C, magnesium sulfate. Question number 3 is, which hormone regulates water balance in the body? Here, correct option is ADH, that means vasopressin hormone. Question number 4, what condition result from overproduction of growth hormone in adults? Here, correct option is option C, acromegaly. Question number 5, which electrolyte imbalance causes trousseaucine? Here, correct option is option B, hypocalcemia. Question number 6 is, when is the hepatitis B vaccine first given to a newborn? Here, correct option is option B, within 24 hours of birth. Question number 7 is, what is the most sensitive cardiac marker of MI, that means myocardial infarction? Here, correct option is option C, troponin I. Question number 8 is, which vitamin is given to prevent hemorrhagic disease in newborns? Here, correct option is option B, vitamin K. Question number 9 is, which drug causes gingival hyperplasia as a side effect? Here, right option is option A, phenytoin. Question number 10, what is the hallmark of nephrotic syndrome? Here, correct option is option B, proteinuria. Question number 11 is, which bacteria is responsible for rheumatic fever? Here, correct option is option B, Streptococcus pyogenes. Question number 12, when is Rh immunoglobulin given to Rh negative mother? Here, correct option is option C, at 28 weeks and within 72 hours post-delivery. Question number 13, what position help relieve umbilical cord prolapse? Here, correct option is option C, knee chest position. Question number 14, which vitamin is essential for calcium absorption? Here, correct option is option B, vitamin D. Question number 15, which drug is contraindicated in pregnancy due to tetrogenicity? Here, correct option is option A, methotrexate. Question number 16, which hormone stimulates milk ejection? Here, correct option is option C, oxytocin. Question number 17 is, what is the function of surfactant in lungs? Here, correct option is option C, reduce surface tension. Question number 18, what causes crackles in lungs on auscultation? Here, correct option is option C, pulmonary edema. Question number 19, what is the hallmark features of left-sided heart failure? Here, correct option is option C, pulmonary conjugation. Question number 20, what is the major complication of thrombocytopenia? Here, correct option is option C, bleeding. Question number 21, which reflex is stimulated by stroking a newborn cheek? Here, correct option is option B, routine check. Question number 22. Which nutrient deficiency causes neural tube defects? Here, correct option is option C, folic acid. Question number 23. Which medication causes optic neuritis as a side effect? Here, correct option is option C, ethambutol. Question number 24. What is the immediate management for status epilepticus? Here, correct option is option A, diazepam IV. Question number 25. Which insulin has the fastest onset? Here, correct option is Lispro insulin. Question number 26. What test confirm latent tuberculosis infections? Here, correct option is option A, Mantoux test. Question number 27. Which cranial nerve control facial expression? Here, correct option is option B, cranial nerve 7. Do you know the name of cranial nerve 7? This is a facial nerve. Okay, let's go. Next question. Question number 28. What is the most common site of DVT in lower limb? Here, correct option is option B, femoral vein. Question number 29. Which vaccine is live attenuated? Here, correct option is option C, MMR. That means measles, mumps, rubella. Question number 30. Which cranial nerve is tested by corneal reflex? Here, correct option is option B, cranial nerve 5 and 7. Question number 31. Which electrolyte imbalance is most likely in diabetic ketoacidosis, DKA? Here, correct option is option B, hyperkalemia. Question number 32. What is the classic sign of increased intracranial pressure? Here, correct option is option A, bradycardia. Question number 33. Which phase of labor is the most painful? Here, correct option is transition phase. Question number 34. Which organism is the most common cause of UTI in females? Here, correct option is option C, E. coli. Question number 35. What is the antidote for heparin overdose? Here, correct option is option B, protamine sulfate. Question number 36. Which diagnostic test confirm appendicitis? Here, correct option is option B, CT seen abdomen. That means CT scans abdomen. Question number 37. Which neurotransmitter is deficient in Parkinson's disease? Here, correct option is option B, dopamine. Question number 38. What is the best position for a patient in shock? Here, correct option is option C, Trendelenburg position. Question number 39. Which blood group is universal donor? This is a very easy question. Here, correct option is option C, O negative. Question number 40. Which part of the brain control temperature regulation? Here, correct option is option B, hypothalamus. Question number 41. What is the gold standard test for tuberculosis diagnosis? Here, correct option is option C, sputum AFB culture. Question number 42. Which condition presents with moon face and buffalo hump? Here, correct option is option B, Cushing syndrome. Question number 43. What is the normal range of INR for patient on warfarin? Here correct option is option C 2.0 to 3.0. Question number 44. Which condition is characterized by high blood sugar during pregnancy? Here correct option is option C gestational diabetes. Question number 45. What is the antidote for acetaminophen overdose? Here correct option is option B acetylcysteine. Question number 46. Which nutrient deficiency causes scurvy? Here correct option is option B vitamin C. Question number 47. Which fetal presentation is most favorable for normal delivery? Here correct option is option C cephalic presentation. Question number 48. What is the expected weight of a baby at 1 year? Here correct option is option B triple birth weight. Question number 49. What is the causative agent of tetanus? Here correct option is option B Clostridium tetani. Question number 50. Which organ is affected in glomerulonephritis? Here correct option is option B kidney. Question number 51. What is the normal respiratory rate? Here correct option is 30 to 60. That means this is a normal respiratory rate in a newborn. Question number 52. What condition present with cherry red spot in macula? Here correct option is option C Tay-Sachs disease. Question number 53. Which test is used for HIV confirmation? Here correct option is option C Western blot. Question number 54. What type of immunity is conferred by vaccines? Here correct option is option C artificial active. Question number 55. What is the cause of kwashiorkor? Here correct option is option A protein deficiency. Question number 56. Which condition is indicated by a positive Phelan test? Here correct option is option B carpal tunnel syndrome. Question number 57. What is the priority action in anaphylactic shock? Here correct option is option C administer epinephrine. Question number 58. Which antihypertensive is contraindicated in pregnancy? Here correct option is option C ACE inhibitors. Question number 59. What is the most common cause of postpartum hemorrhage? Here correct option is এর কারেক্ট অ্যান্সারটা আপনারা দেওয়ার চেষ্টা করুন। সবাই জানে পোস্টপার্টাম হেমারেজের কমন কোজ কোনটি, ঠিক আছে? অপশন এ তে আছে রিটেইনড প্লাজেন্টা, অপশন বি তে আছে ইউটেরাইন রাপচার, অপশন সি তে আছে ইউটেরাইন অ্যাটর্নি, অপশন ডি তে আছে সার্ভাইকাল টিয়ার। তো কারেক্ট অ্যান্সারটি আপনারা নিজে থেকে দেওয়ার চেষ্টা করুন। দেন কোশ্চেন নাম্বার 60. হোয়াট ইজ দ্য আর্লিয়েস্ট সাইন অফ হাইপোভলিমিক শক? Here correct option is option C tachycardia. Question number 61. Which condition causes a butterfly rash on face? Here correct option is option B SLE. Question number 62. What is the purpose of Ringer's lactate in burns? মানে RL saline কোনটি পারপাসের জন্য দেওয়া হয় বার্ন পেশেন্টকে? Here correct option is option C fluid resuscitation. Question number 63. What is the best site for IM injection in infant? Here correct option is option C vastus lateralis. Question number 64. What is the primary symptom of meningitis? Here correct option is option B neck stiffness. Question number 65. What condition is associated with Binge-Jones protein in urine? Here correct option is option A, multiple myeloma. Question number 66. Which test is done to confirm DVT? তোমরা কি জানো ডিভিটির ফুল ফর্ম কি? ডিভিটির ফুল ফর্ম হচ্ছে ডিপ ভেন থ্রোম্বোসিস। Here correct option is option A, Doppler ultrasound. Question number 67. Which cell produce insulin? Here correct option is option B, delta cells. Question number 68. Which hormone is responsible for uterine contraction? Here correct option is option C, oxytocin. Question number 69. What is the common complication of mumps? Here correct option is option A, orchitis. Question number 70. Which technique is used to assist fetal well-being in third trimester? Here correct option is option B, non-stress test. Question number 71. Which condition result from folate deficiency during pregnancy? Here correct option is option A, anencephaly. Question number 72. Which vitamin prevent night blindness? Here correct option is option A, vitamin A. Question number 73. What condition is suspected with a positive Murphy's sign? Here correct option is option B, cholecystitis. Question number 74. What is the earliest sign of dehydration in infants? Here correct option is option A, sunken fontanelles. Question number 75. Which vaccine is contraindicated in immunocompromised child? Here correct option is option B, MMR. Question number 76. What condition result from deficiency of intrinsic factor? Here correct option is option B, pernicious anemia. Question number 77. Which lab value is elevated in pancreatitis? Here correct option is option A, lipase. Question number 78. What is the function of erythropoietin? Here correct option is option C, stimulate RBC production. Question number 79. Which medication is used for absence seizures? Here correct option is option C, valproic acid. Question number 80. What is expected Apgar score for normal newborn at 1 minute? Here correct option is option C, 7 to 10. Question number 81. Which drug is the first line treatment for status epilepticus? Here correct option is option B, diazepam. Question number 82. What is the hallmark symptom of nephrotic syndrome? Here correct option is option B, proteinuria. Question number 83. Which gland regulate metabolism in the human body? Here correct option is option B, thyroid gland. Question number 84. What condition is indicated by a positive Babinski reflex in adults? Here correct option is option D, upper motor neuron lesion. Question number 85. Which test is used to assist blood clotting in heparin therapy? Here correct option is option C, APTT. Question number 86. What is the priority nursing action during a blood transfusion reaction? Here correct option is option C, stop the transfusion. Question number 87. Which vitamin enhance iron absorption in the intestine? Here correct option is option B, vitamin C. Question number 88. What is the primary route of HIV transmission? Here correct option is option C, sexual contact. Question number 89. Which bacteria is the most common cause of peptic ulcers? Here correct option is option C, Helicobacter, that means H. pylorus. Question number 90. What is the preferred site for subcutaneous heparin injection? Here correct option is option C, abdomen. Question number 91. Which hormone control blood calcium levels? Here correct option is parathyroid hormone, option number C. Question number 92. Which test is done before initiating warfarin therapy? Here correct option is PT by INR. Question number 93. Which condition causes reddish urine without RBCs? Here correct option is option B, myoglobinuria. Question number 94. What is the gold standard test for myocardial infarction? Here correct option is option A, troponin I. Question number 95. Which fetal position lead to prolonged labor? Here correct option is option B, occiput posterior. Question number 96. What is the normal blood urea nitrogen range? Here correct option is option B, 8 to 20 mg per deciliter. Question number 97. Which medication is used to prevent postpartum hemorrhage? Here correct option is option A, misoprostol. Question number 98. What is the first nursing action during a seizure? Here correct option is option C, turn patient to side. Question number 99. Which lab value indicate kidney function? Here correct option is option C, creatinine. Question number 100. Which technique is best for pain relief during labor? Here correct option is option B, controlled breathing. হেই এভরিওয়ান, আমি প্রত্যেকদিন আপনাদের জন্য 100টি কোশ্চেনের সিরিজ নিয়ে আসবো, ঠিক আছে? অ্যান্ড এই 100টি কোশ্চেনের মধ্যে আপনারা কত নাম্বার পাচ্ছেন, মানে 100টি কোশ্চেনের মধ্যে কয়টা আপনারা রাইট করছেন অ্যান্ড কয়টা কোশ্চেন অ্যান্সার আপনারা রং করছেন, এটা আমার কমেন্ট সেকশনে একদম জানিয়ে যাবেন। আমিও দেখতে চাই যে কার জন্য এই কোশ্চেন প্যাটার্ন ইজি অ্যান্ড কার জন্য মডারেট অ্যান্ড কার জন্য হার্ড। ওকে গাইজ, বাই বাই, দেখা হচ্ছে পরের ভিডিওতে।